Salivary gland disorders. They are of 7 types: developmental, functional, inflammatory, obstructive, autoimmune, neoplasms, and sialadenosis. Under developmental, we have aplasia, hyperplasia, aberrant salivary gland, atresia of the ducts. Functional, may we have siloria and xerostomia, depending upon the salivation. Inflammatory, we have viral, which is the cause of mumps, caused by paramyxovirus, which is an RNA virus. Then bacteria causes sialadenitis. Then allergic and necrotizing sialometaplasia. Then obstructive, we have sialolithiasis and mucocele. Autoimmune में Jogren and Michel's disease. Under neoplasms, pleomorphic adenoma, Warthin's tumor, mucoepidermoid carcinoma, and adenoid cystic carcinoma. Mumps is caused by virus, paramyxovirus or cytomegalovirus. Bilateral parotid swelling is seen. The window period is 2 to 3 weeks. Affects the age group of 10 to 20 years. Acute non-suppurative sialadenitis is seen. Paramyxovirus, RNA virus is the cause. It comes with the prodromal symptoms like fever, fatigue, and malaise, which are seen with all the viral infections. Sialadenitis caused by bacteria. It affects the parotid gland, mainly the serous parotid glands, and it affects the gland through the ducts, not directly the gland. There is obstruction of saliva. The infection is a retrograde infection, which first occurs in the duct and then to the gland. Usually, submandibular gland is not affected because it is mucinogenic in nature. It is highly viscous. We can also call it sialodocytis because it is ductal sialadenitis. Necrotizing sialometaplasia. It is divided into 2 parts. Necrotizing means necrosis, and sialometaplasia, that it affects the salivary gland acini. That is necrosis occurring in the salivary gland acinis due to the metaplasia. The ulcer is craterform. It is more common in palate in the posterior part. There is formation of nodular mass which ulcerates and causing the large necrotizing ulcer. It is similar to the carcinoma of the palate, squamous cell carcinoma. The average healing time for necrotizing sialometaplasia is 5 weeks, and it resolves after little debridement and giving the antibiotics. Whereas the squamous cell carcinoma will have no effect of debridement or antibiotics, and it will continue to grow, and hence palate can fall off. Now obstructive, we have sialolithiasis. A sialolith is present in the ducts, which is a calcified stone-like structure. It is hypermineralized. The patient of sialolithiasis has normal calcium and phosphorus levels in the blood. The sialolith is formed due to the stagnation of the salivary flow, which is stuck as a viscous mass in the duct, in the salivary ducts, and it acts as the nidus for the bacteria to grow. Sialolith has more tendency to form in the Warthin's duct because it has more mucin, which means more viscosity. And the other reasons for occurring in the Warthin's duct is that it is going upwards against the gravity. It has a sharp curve at the mylohyoid muscle level, which helps in the stagnation of the salivary flow. The pathway of Warthin's duct is tortuous in nature. The duct opens subgingivally in the sublingual area around the mandibular incisors, around the lower lip, which is why it is more prone to trauma. Diagnosis is done by the occlusal radiograph, where radio-opaque small calcified structure is seen. Clinically, we see there is a lot of pain in and around the males, but it subsides usually after 1 to 2 hours. The treatment is lithotripsy, which is a shock wave therapy. Now mucocele, it is of 2 types: extravasation and retention. Duct cyst or true cyst, which has epithelium lining. Extravasation has no epithelium lining, so it is a pseudocyst. It occurs more commonly in children and young adults. This pseudocyst is lined by compressed connective tissue. There is trauma in the salivary gland ducts. Then the mucin comes out, and there is accumulation of mucin, which takes the form of cyst. It is also more common on the lower lip. Then the retention, mucocele. There is obstruction of saliva in the duct, bulging out, resulting in cystic formation, lined by epithelium cells. Ranula resembles the belly of frog. It is a form of mucocele present in the floor of the mouth. It is a blue color, and it never crosses the midline. Then plunging or cervical ranula. It dissects through the mylohyoid muscle, resulting in the swelling in neck. Michel's disease, it is a bilateral swelling of lacrimal gland and parotid salivary gland, resulting in lack of tearing and salivation. This disease is the mild form of Sjogren syndrome, where we see improvement with the steroids, and it is also known as the benign lymphoepithelial lesion of salivary gland. Sjogren syndrome divided into primary and secondary. In primary Sjogren syndrome, we see Raynaud's phenomena, thrombocytopenia, and kidney involvement. In secondary, we see all the symptoms of the primary Sjogren syndrome plus rheumatic disease, lupus erythematosus, and scleroderma. Other clinical features are dry eye or dry mouth for more than 3 months, therefore called Sicca syndrome, and swelling of parotid gland. There is no lacrimal gland swelling. There is association of HLA-DR W52, HLA-B8, and HLA-DR3, which are increased in primary Sjogren syndrome. The cause is Epstein-Barr virus, which is also an etiology of Hodgkin's lymphoma and nasopharyngeal carcinoma. The tests for diagnosis are Schimmer's test and Rose-Bengal test, and unstimulated salivary flow. Histopath reveals more than 50 leukocytes. In the unstimulated salivary gland flow, when it is calculated, it comes to be less than or equal to 1.5 ml in 15 minutes. The site for biopsy is lower lip. On xylography, we see fruit-laden branchless tree appearance. Other appearances of xylography are normal salivary gland and mandibular salivary gland appears as a leafless tree, parotid gland as leafless bush. In Sjogren syndrome, we saw the fruit-laden branchless tree or fruit blossom. And in the neoplasm of the salivary gland tumor, we see ball on end appearance. Now, sialadenosis or sialosis, which is non-inflammatory and non-neoplastic, bilateral enlargement of the gland without any cause is seen, and the pattern is leafless tree pattern. Pleomorphic adenoma, it is common in palate. Swarm of bees appearance is characteristic. It is a benign mixed tumor. Etiology by Regzi and Batsky. According to them, it is due to the duct reserve cells, which are pluripotent and undifferentiated. And there is a growth of tumor-like epithelium and stroma. Its recurrence is attributed to the presence of incomplete capsule. According to the new theory, it arises from the myoepithelial cells and new cells. So now it is called pseudo-mixed tumor. 80% of pleomorphic adenoma occurs in parotid gland extraorally and palate intraorally. Warthin's tumor or papillary cyst adenoma lymphomatosum, usually found in smokers on fluid aspiration, looks brown. 5 to 14% cases are bilateral. There is equal predilection for both males and females. Usually in salivary gland neoplasms, it is more common in females than males. Mucoepidermoid carcinoma, it is the most common malignant salivary gland tumor of children and the most common tumor of minor salivary glands. There are 3 criteria for grading it. First, cystic content, second, atypia, and third is the relative number of mucoepidermoid intermediate cells. Histopath reveals clusters of clear cells, which are generally mucin and glycogen free. And facial paralysis is also common in mucoepidermoid carcinoma. Now, according to the criteria, if there is more cystic content, then it is less severe condition. And in high grade severity, the mucus is low and the epidermoid or intermediate cells are more. And therefore, in the low grade or grade 1, we see less epidermoid intermediate cells, increased cystic content, and decreased atypia. There was a new criteria discovered by Brandwein, which was based on the combination of different histopath and other clinical features. Adenoid cystic carcinoma or cylindroma. Histopath reveals Swiss cheese pattern, cribriform pattern, solid pattern, which is highly aggressive. Neural invasion is seen. Facial paralysis is common, therefore more predilection for females, the middle-aged.